Hi, my name is Tameka Little. I am a student at the University of Mount Olive. I am pursuing a dual master's degree both in nursing administration and nursing education. I'm here to share with you a presentation about quality of care for my Nursing 600 education clinical assignment. Quality of care, research and evidence-based practice. The Magnet Recognition Program. According to the American Nurses Credentialing Center, the Magnet Recognition Program is designed to honor deserving hospitals that display clinical practice environments for nurses that are supportive, collegial, and engaged in the autonomous clinical practice of nurses. It is good to know that it is not an award. However, Magnet hospitals emphasize the importance of leadership, individual growth and development on both a professional and a personal accord. In addition, novel knowledge, innovation, and positive patient outcomes are sought for in Magnet-designated facilities. In the past, the American Nurses Credentialing Center used 14 forces of magnetism to characteristically define magnet hospitals. At this time, 5 components are used to outline the foundational basis of magnet designation. The purpose of this video is to highlight the important aspects of quality of care related to the Magnet Recognition Program and as it pertains to research and evidence-based practice. I will be focusing on how quality of care relates to new knowledge, innovation, and improvements, as well as empirical outcomes. New knowledge, innovation, and improvements. Subsequently, nursing practice should be supported in magnet facilities with the inclusion of nursing standards, nursing research, and the utilization of evidence-based practice. Additionally, safe practice and optimal outcomes are impacted by innovation, redesign, transformation, and knowledge expansion in magnet facilities. Because of these characteristics of magnet facilities, they are deemed leaders in the advancement of nursing science, learning, and discovering new nursing innovations. Empirical outcomes. To reflect on empirical outcomes, the previous magnet model focused on the structure and process of achieving patient outcomes. In the new magnet model, magnet focuses on patient outcomes in the clinical environment, the community, the workforce, and within the organization. For example, patient outcomes such as patient experience, retention of millennials, increasing nursing research use and utilization, and community partnerships are all examples of empirical outcomes. Evidence-based practices should encourage practice change in magnet facilities. Involvement in professional nursing organizations, nursing research studies, and shared decision-making councils are all great ways for nurses to participate and engage in evidence-based practice changes within the workplace. Professional development is seen when nurses return to school to obtain degrees in higher nursing education or when they pursue nursing certifications. At my workplace, we use the National Database of Nursing Quality Indicators to ensure compliance with nurse-sensitive indicators. Professional practice models are fundamental to nursing practice. Excellence in patient-centered care and improving the quality of care delivered to patients. Professional practice models involve caring, knowing, navigating, and leading the way. The Therapeutic Alliance model focuses on learning partnerships to collaborate and negotiate with the nurse. Nurses are both active and responsible for their clinical practice. Therefore, self-determination and control over their professional practice must shift towards the domains of the magnet facility's professional practice model. Through compliance and adherence and alliances, change can occur that guides quality of care, which is based upon research and evidence-based practice. This model was chosen because it enables me to focus on the nurse's actions and how they provide professional excellence in the nursing care that they provide to patients. In addition, I can gear my educational efforts towards collaborating with nurses in the promotion of caring, knowing, navigating, and leading to promote the health of patients. By doing so, I will be able to utilize the professional practice model effectively. Concordance, or the mutual respect that is held for nurses during consultation of nursing staff, is the best way to respect the nurse's professional beliefs and negotiate the best course of action for patients and their families. Likewise, the ultimate goal of concordance is process-driven to then improve patient outcomes. Therefore, quality bundle compliance, research and evidence-based practice, as well as patient experience will only benefit from the effects of focused, action-driven concordance with nursing staff. Motivational interviewing will be used to evoke intrinsic motivation as I explore and find innovative solutions to improve the quality of care provided to patients. Using motivational interviewing, I will use a two-phase process that involves enhancement of intrinsic motivation and then strengthening nurses' commitment to change workplace behavior that falls short of meeting quality of care standards. During interview sessions with nursing staff, there will be strategies used during the interview process. For instance, to understand nurses' beliefs and behaviors regarding nursing sensitive indicators, I would ask them which change in the nursing bundles is most important to discuss. Or, I would inquire about the benefits of nursing research to them to assess whether it has any importance. If not, I could develop a plan to increase the importance of research by showing the benefits of it. I may even ask the nurse manager what are the drawbacks to evidence-based practice or policy changes in their specific unit. Or I may ask nurses, in what ways has your enrollment in school impacted your professional development? It is also possible that I may ask nurses how confident they are in starting a journal club on their unit to facilitate a culture of evidence-based practice.